one thing that is completely free, if you could just do one thing, and that's to remove all of that soda or sugary drink, whatever it is, sweet tea in the South, right? And if you can just get somebody to replace all of their fluid intake to be water, that's free. The other things cost money. And that is a huge, huge difference in the health, right? And we know that the cells communicate, right? Your cells are filled with water. And so making sure that you're, getting that healthy amount of water is literally going to help the cells and their ability to communicate in your body. And that you can do without costing any amount of money. That would be very beneficial.
Hello and welcome to Cocoa Pods podcast. My name is Dr. Bola Sogade. I'm a women's health specialist. We have been talking to Dr. Jessica Patella, a naturopathic physician who has been talking to us about naturopathic medicine with respect to maternal health. So, now we want to look at evidence-based practices and some latest research in naturopathic medicine. Does the naturopathic doctor integrate evidence-based practices into their treatment?
Yes, absolutely. And I'm so glad you brought this up, because I think there just needs to be so much more knowledge around this topic. And so as naturopathic doctors, we're trained not only to reach out to our medical colleagues, so reaching out to the medical doctor, so that way we can work together. I think the best patient medicine comes when you have somebody that's well educated in the natural and holistic sense that also can work with the medical doctor, and it can almost become a team for that patient. So, I feel like that is a great resource. But then we also, read the medical journals and look at what is the most up to date with different supplements, herbal medicine, homeopathic medicine, and how those are being used to treat different conditions and different disease states. So absolutely using medical research to guide what we're doing is absolutely used across the profession.
Thank you. And so it's best to have collaboration with people in what we call conventional medicine, or is there a lack of it most of the time? And I want to look into the relationship between naturopathic and conventional medicine. So is the naturopathic doctor open to collaborating with the conventional medical practitioners and vice versa? Have you seen anything?
Yes, the majority. I mean, I can't speak for everybody, we're all different, but I know that that's how we were trained, is that it's best to work as a team to help that patient, and recognizing the differences in our education and background, right? And so, I fully recognize that I'm not an OBGYN, and those are different skill sets that I don't have, and I'm not able to do those things, but I can help with homeopathic remedies, right? So having that team to work together to help the mother in all those different aspects is very helpful. Now, this is just my personal opinion. I do feel like as naturopathic doctors, we're more open to that collaboration. Even with medical doctors that I, have worked with and I adore, there's a lot of misunderstanding as far as the education and the background. And so I feel like sometimes that's a harder thing to jump, because they're like, well, you don't do anything that has any research. And it's like, well, we do. And there are medical journals that focus on a lot of the health related supplements and nutrition and diets. So, I think it's just the more we learn and the better educated we become, hopefully the stronger that connection and that communication can become.
Yeah, and I think everybody has to respect everybody else's line of expertise. And it would be nice to have naturopathic doctors present at the annual meetings, the annual conventions of OBGYNs, and, vice versa, because, no knowledge is wasted. Every knowledge is good. But, just moving on, there's the issue in terms of the duration of treatment, the frequency of visits, and a personalized treatment plan. So, the women out there will want to know, what are the costs associated with naturopathic care? Does insurance cover naturopathic treatments? And if not, what are the payment options? You know, and I know, naturopathic doctors put an emphasis on holistic and individualized care. So, what are patients looking at cost wise?
Great question. So the first visit with a naturopathic doctor, and again, this varies based on the person, but that first visit is typically an hour to 2 hours long. It just depends on who you're meeting with. So a lot of time is spent understanding that patient, trying to understand what it's like to be in their shoes and to make that the treatment plan individualized to them based on what their concerns are. A lot of times when I was in North Carolina, most of my time would be spent explaining labs and that they had to patients. So a lot of it comes down to and spending time educating within that visit and trying to understand that person. And then follow-up visits get shorter, 30 minutes, sometimes 20, because it kind of depends on what is needed and for that person. And then as far as payment, most of it is cash based. Depending on the state, there are a handful of states out of the 26 where naturopathic doctors are on different insurance plans. So it kind of depends whether you are in a state that licenses naturopathic doctors. So if it's a licensed state, then some of those states do have insurance options for naturopathic doctors. So it just is going to vary based on where the woman is in the country.
Yeah, this is almost like the problem we run into with birthing centers. Is it that the insurance companies just don't understand what naturopathic doctors do, or what freestanding birthing centers do, or what is involved in holistic care? Because why do you think most of the care is cash based when it comes to payment?
I know it's a great question. And I feel like it's mostly poorly understood, right? Like, that the services that you're providing are actually saving a ton of money by having them in your center. It becomes a more intimate situation, right? It's a more peaceful situation overall. So they have this amazing benefit and probably even a little bit more of your time and attention because it's done with that as the heart behind it. So I can't even begin to tell you that I understand insurance companies and why things are covered and why things aren't. But again, I just think most of what we do as naturopathic doctors, right, if it was understood, the idea is that we save a lot of money for people in the long run. I've had patients before where it's just teaching them about their body and how to kind of be aware of what they're eating and the different symptoms they have. And once they have that knowledge, that's there for the rest of their life. So maybe it was an investment of a few $100s over a period of time to come in and see me as we work through those things. But then that's life knowledge and they have that forever versus just a script that you take and you pay that a few $100s and you take it a few times. They now have a base knowledge that they can come back to at any time in their life. So yeah, it's just very different. And I think probably most of it's just not understanding the benefit of the difference in in a birthing center in naturopathic medicine and how much it does offer.
Thank you for that. The use of herbal medicine, botanicals, is a common practice in naturopathic medicine. That is, you may prescribe herbal remedies to address a range of health issues. And this brings me to the condition of menopause. Okay. How can homeopathic remedies address common symptoms of menopause, like the hot flashes, the night sweats, the mood swings, the sleep disturbances, the dryness in the female parts? Are there specific homeopathic remedies that cater to individualized symptoms experienced during menopause?
Yes, this is a great question. So, and this helps me to describe a little bit about the kind of the list of remedies that I shared with you for labor and delivery. A lot of times we see if it's an acute situation, right? Like labor and delivery is acute, it's going to be very intense and it's going to last a short period of time. We see that certain remedies kind of show up and have that picture, and we can kind of in acute, like, almost like first aid type situations, things tend to follow the same symptoms. So it's easier to say, like, okay, these would be the top remedies. When it comes to menopause, right now we're looking at more of a chronic thing, right? So perimenopause can last for years. Some people, it's a decade, right, of their life as they're transitioning out of their menses. So that becomes more of a chronic remedy in the sense that every person that comes in with symptoms of menopause are likely leaving with a different remedy because some people are having the mood swings and they're very irritable, but it's different things that are making them irritable. So that would indicate different remedies. But as far as hot flashes, it depends almost where the heat is coming from in the body, right? Some people describe that it comes from like their abdomen and their core and it moves up their whole body. For other people, it's like it starts at their head and it's moving down. So all of those different things go into trying to figure out an individualized homeopathic remedy for that woman going through menopause. So it's a little bit different because it's more of a chronic state. So that would take a different, like, individualizing that to that woman for that period of menopause. So yes, you can still use homeopathic remedies quite well, but it becomes a more in-depth process as far as finding it because it's not like acute to where everybody gets the same exact symptoms.
So, can homeopathy provide relief from hormonal imbalances associated with menopause and, lifestyle changes, dietary recommendations that can complement homeopathic treatments for menopause? Do you want to say something about that?
Sure. You can absolutely use homeopathic medicine along with diet. So almost every time I speak with somebody, it's diet and supporting with that. So trying to get in, I mean, it comes down to the basics, right? Usually it's trying to get in more vegetables, less sugar, less processed food. I mean, that's kind of the basics of overall. And then varying that based on the person and what they might be sensitive to or not sensitive to. You could totally work depending on the state, right? So some naturopathic doctors are able to prescribe bioidentical hormones, others are not, right? So there's another way that collaboration could be really helpful of looking at the different labs and what the hormone levels are and collaborating with a medical doctor that can prescribe that, but then also adding that diet and also adding the homeopathic remedy into. So really collaborating on that, I think would be the best, depending on, of course, what state you're in.
Well, I've had, African women like talk about the African yam and the skin of the
Yes.
African yam helping with menopause. And there's black cohosh out there. I mean, what are some of the actual things in homeopathic medicine that we could use in menopause, and are there side effects? How long does it take for them to kick in, you know?
Yes, no, black cohosh and yamas are both great remedies. So again, that's more of the botanical medicine. With botanical medicine, it can take longer. In botanical medicine, it can take 1, 2, sometimes 3 months to see that change. I think of it as it's almost like a more mild form, right? So it can kind of take a little bit longer to see those results when you're using it. Some people are very sensitive and they'll react fairly quickly, but with botanicals, just be prepared that sometimes it can take a few months in order to experience the benefits of taking those.
Thank you. You did talk about obesity and weight, and we are experiencing an obesity epidemic in America. This is a field I believe especially emphasizes preventive healthcare, that is homeopathy, and it promotes overall wellness and disease prevention. So, how does the dietary advice you give and the recommendations for nutritional supplements help support health and address specific conditions such as obesity?
Yes, I did my research actually at Florida State on this. So let me try to remember we have to give all these wordy titles to research. So it was lifestyle modification in lower socioeconomic overweight and obese women with, yes. I'm like, is that all the words? Did I put them all in there? And so this was like right when pedometers were coming out. And so we were researching, in exercise physiology, how much could movement help with these things? And I specifically wanted to look at glycosylated hemoglobin and see, okay, will movement help with essentially blood sugar? So like looking at diabetes there essentially. And it was really an eye-opening experience. So we went into an area that was more underserved in Tallahassee at Florida State. And a lot of our visit was like, are you wearing this? I mean, some of the steps for the whole day were 300 to 400 steps for the day. And so I don't know if you've counted your steps before, but that's kind of just getting up to go to the bathroom, and that's about it for your whole day. So I think so much of it is movement, right? We have to move. Our bodies were made to move. Our bodies were made to move and do physical labor, which we don't really do much anymore, right? So most of us are sitting at desks most of our day, and we get very little walking. So any opportunity there is to be outside walking, I think being outside helps so much with stress, no matter what the age, from young children all the way up to adulthood, right? So having that ability to just be outside, moving and walking as much as possible. And then with diet, having this background in nutrition, and I teach nutrition to students, and so a lot of times I'll have them analyze different diets because we get so much information, and one of their final projects is usually to compare two different diets. And I tell them, choose some that are at the opposite ends of the spectrum. Choose a vegan diet versus like an omnivore diet. So like almost as completely opposite as you can get. Because when you read these things, they're all going to say that their way is the best, right? That what they're presenting is the best way. So over the years, I've read and studied so many different diets. Typically, across the board, almost all of them remove sugar or limit it significantly. Most of them are removing more of the processed foods and grains and increasing our fruits and vegetables. So across the board, with that knowledge, if people can add that in with movement, I think that's really important. The challenge becomes the affordability, right? It's very affordable. Well, I feel like this is starting to change. It's getting very expensive in our state of our economy right now, but it's more affordable for somebody to go to fast food and be able to use, $5, $10 to get a very calorie dense meal versus how many fruits and vegetables can they buy with that. It's very expensive. A thing of blueberries sometimes now is, $5 to $7 versus you can go get a whole fast food meal. So this is where that like discussion I think needs to come in on creating like almost like victory gardens that they had during World War II, where a community would come together and create a garden just to help with having those fresh things available for the little neighborhood, essentially.
Yeah, because that's a fact, because at times the underserved women or people with limited resources, number one, they say, they can't walk outside because the neighborhood is not safe. So we encourage them to, maybe, walk indoors within the apartment complex, up and down the steps, or find a park that they can go to. And some of them say, well, I just can't afford to eat healthily. Like you said, it's just so expensive. And I think, the victory gardens, the community gardens, and, even when they get support from the government, making healthy choices, can all help, towards just this better healthy living and, weight management and obesity prevention. I mean, you would agree with that, right?
Yes. And even, it just popped into my mind, one thing that is completely free, if you could just do one thing, and that's to remove all of that soda or sugary drink, whatever it is, sweet tea in the South, right? That's hard to take away from somebody. And if you can just get somebody to replace all of their fluid intake to be water. That's free. The other things cost money. And that is a huge, huge difference in the health, right? And we know that the cells communicate, right? Your cells are filled with water. And so making sure that you're getting that healthy amount of water is literally going to help the cells and their ability to communicate in your body. And that you can do without costing any amount of money that would be very beneficial.
Yeah, yeah. Thank you. Thank you for that. I don't believe conventional medicine adequately addresses stress, like life stress. So as also a lifestyle counselor, I believe you are also a lifestyle counselor, are you? Kind of.
Well, we do a lot of lifestyle counseling. I don't have like a special
Okay.
degree or certification in that, but that is a lot of what we do as naturopathic doctors is talking about
Yeah.
what life stress is and what's going on.
In our upcoming episode. Yeah, so well, as somebody who does lifestyle counseling, how do you work with patients to make positive lifestyle changes, including, stress management, exercise, sleep hygiene, dealing with life crises, issues in life, with all the ramifications of that?